In this presentation, we'll be looking at the microeconomic model of implementing an urgent care center within the community of Orlando, Florida. The goal of this project is to implement an urgent care center within our current healthcare community. The population need for this service in the city of Orlando, Florida is 280,257 as of 2017. The urgent care center would meet the needs of all ages in terms of providing healthcare services to the community. Urgent care centers reduce the costs. An urgent care visit is a lot cheaper than an emergency room visit in terms of providing the type of services that an urgent care center would provide. There's an increased profit to the healthcare organization as a whole. Adding the urgent care center means additional income. Just 3% of patients who come into an urgent care center need to be diverted to an emergency room. Thus, we're decreasing the rehospitalization and reducing unnecessary trips to the emergency room, which obviously are a lot more costly than an urgent care visit. The demand. Urgent care centers report that they service approximately 12,000 patients in a fiscal year, and this data was obtained from 2015. That's 3 patients seen every hour, a total of 32 visits per day. Approximately 27% of U.S. patients reported that in 2016 they visited an urgent care center at least once over a 2-year period of time. In terms of public health policy and urgent care centers, value-based care pay models and ACO healthcare models focus on improved quality of care, and in that look at penalties that are applied onto the practitioners for potential for rehospitalization. Urgent care centers would act as the intermediate care center to provide services while patients remain in the outpatient setting. In terms of budgetary needs, the average cost for building an urgent care center costs about $850,000 and between $1 million. This includes the building of the healthcare center, supplies, and equipment. Typically, the average urgent care center would have 7 exam rooms. The typical staffing pattern for this organization would be 1 physician, 1 physician assistant, 2 medical assistants, 1 radiologic technician, 1 center manager, and 2 receptionists. The advisory board committee estimated that the average center makes $118 per patient visit. Combining those figures means that the urgent care clinic makes an estimated $2.1 million a year. Keep in mind, we're only paying $1 million maximum for the build-up and startup of the organization. Challenges versus incentives. Of course, the challenge is we're going to need a surplus of funds to create this project. We're going to need to take a look at our budget and review areas for potential cuts and savings in order to come up with the increased amount of money we need up front to build the urgent care center. However, with that being said, after the initial startup and 1 year of service, we will make back what we spent, plus add on an additional $1.5 million on average. In summary, there is a huge need and demand in the community for urgent care centers in order to provide another layer of healthcare services outside of the emergency room. There is a demand for a quick visit to meet the healthcare needs of the population. It also meets the value-based pay model and ACO models in terms of providing quality of care without rehospitalization. And then we, of course, would see an excessive income annually related to the number of patients that we will be servicing. It is my opinion that it is financially smart and behooves the healthcare organizations to go ahead and implement an urgent care center within our healthcare organization. Thank you for your time.